Welcome to COVID Talk. I have with me Professor Reynir Arngrimsson. He is the president of the Icelandic Medical Association and professor for genetic medicine at the University of Reykjavik in Iceland. Professor Arngrimsson, what is the strategy to deal with the COVID pandemic in Iceland? You had some cases coming with returning tourists to the island now, and COVID has reached Iceland as it has reached many other parts of this world. What is your strategy now?
Well, our strategy is basically testing and quarantining and recommending social distancing at the moment. We haven't closed the country for tourists, but there are very few flights at the moment. The government is trying to secure some flights, so there are only 3 flights to 3 destinations at the moment. All other flights have been postponed, basically because there is no one flying to us at the moment. So we have been heavily involved in testing and looking for people that we need to put in quarantine. So it's a very similar approach as they did in South Korea as well. We didn't stop tourists from coming, and we see from the data we have that a lot of the original infections came from Europe, from Austria, from the ski resorts in Austria and Italy. But we have seen through sequencing of the virus, we have been sequencing actually the code of the virus, and we see it originates in Europe. There are some from the States actually. We have seen viruses or RNA codes that are originated in Iran. So it seems to be coming all over the place to us.
You have seen already some of the severe cases. Unfortunately, some of your patients already died. If the numbers I see are actual, it's 2 people who died. You had 12 in ICU, not all at the same time as far. So far, what about the capacity of Iceland to deal with those cases and the serious cases? Do you see Iceland fit for dealing with it?
Yeah, we believe so. We have had some predictions model, and we think this is working. Our strategy is working. We were worried about the capacity of the ICU unit. We only had 26 respirators. Mind you, the population is only 360,000. But we were able to get more, so we are waiting for more respirators to arrive at the moment. So we think we can deal with up to 50 ICU cases, and our predictions models is probably, we're going to cope with that, but it's difficult. And may I just mention about the 2 deaths? Unfortunately, one of the deaths was a tourist that was traveling in Iceland. We didn't have the same strategy of testing tourists. We only tested Icelanders coming home and putting them in quarantine. The feeling was that the tourists were actually not that many when we came into the pandemic, and they were not in so much contact with Icelanders as well. But unfortunately, there was a young tourist, a male in his just 40 years old, who came to the hospital with other complaints, and there was no suggestions that he might have COVID infection, but he unfortunately died from some other underlying causes, which tells us what the experience that if you have underlying cause, you can collapse very quickly.
Do you have measures, strict measures of distancing in place, or do you have even a lockdown in the country?
We don't have a lockdown, but we have implemented now that only 20 people can gather together. We started with 100 people, but it was reduced to 20, and you have to keep a distance of 2 meters between individuals, and that applies to shops, and all gathering, workplace as well. Some of the main companies for like the food industry can get an exemption, have more people working if they abide to very strict measurements in the workplace. So we have that in place. We have closed all the swimming pools. There is no any sports is closed. You cannot do that, but we're still running the schools. The schools for the young ones from 6 years old to 14, 15 years old. The schools are open, but they have to abide to this only 20 pupils in a class, and they are supposed to have 2 meters between them. But with young children, you cannot really guarantee. So some parents have taken the children out of the school, but it has not been recommended.
I assume with the tourists coming back, returning to Iceland, you had in majority a young population returning with the virus, so to speak. Mm-hmm. Is that also what you see in your ICU cases or in your hospitalization cases, or do you have already there a shift to older patients?
It's a shift to the older patients. They are from the age of 50 and upwards, and we haven't seen any younger who is needing ICU at the moment. Probably one advantage is we have a young population compared to Europe. So the age distribution is advantage to us in dealing with this, we hope. But what we see, if we do the predictions model, we see that the curve is flattening, definitely, for the infected individuals in that. But in the ICU unit, the numbers needing ICU treatment is following the worst or the blackest prediction models that we have, which is the worrying part at the moment for the health authorities. And so they have just recently or yesterday announced that they would prolong the social distancing, and I wouldn't be surprised that if there would be a stronger recommendations coming in the next couple of days, just to make sure that our health system will cope, that the hospital will cope.
Yeah. This brings me to another question when we speak about coping with the situation. What is the supply side of this? We see a sharp demand and a lack of supplies in personal protective equipment, but also in ventilators in other countries. Is that something you have experienced as well?
We haven't come to a shortage, but we're in the same situation as everybody else, that nobody predicted this scale, this pandemic of this scale. So we have acquired more respirators, and we are now trying to secure more of the personal protective units, masks and gowns. And we believe that we will get more and we will have sufficient, but as you know, in these times, you don't really know until it has landed in the country at the moment. So we are worried for that. But at the moment, we have enough, at least until after Easter. But we will need to make some arrangements before Easter to get hold of more PPEs. We have been testing quite a lot. So it looked like we have probably been testing about 20,000 people. And we had a situation that it looked like we were running out of testing or sample units. But that has been solved for the moment, and we're hoping to get more, because that is a key to our strategy, is to find people who are infected And thankfully, we have now more than half of the people that we diagnose now or test COVID positive, they are already in quarantine, which shows that this approach is working quite well. If they hadn't been quarantined, we would have a much more spread at the moment. The sample pins were a big deal a few days ago, but it seemed to be solved. But now we're focusing on the PPEs to get that to the country.
Your strategy to test, is it a random approach to testing, or do you have a certain specific target audience you're looking for?
We are actually doing both. The hospital system is only taking people, clinical cases, as we can say, people with symptoms, and healthcare providers, they can be tested. But then we have a collaboration with Decode Genetics, which is more known for genetic research. They offer to test randomly people. So about 10,000 people have been tested in them. And these are individuals that might be worried. They might have some minor symptoms, but majorly do not have any symptoms at all. So we believe that this gives indications of the background infection in the community. It's not exact one, we know that, not yet, but we will be testing more. And at the moment, we're just in that sample, the infection rate or positive rate is just less than 1%. So it is not spreading very fast through the populations, it seems at the moment. But in the groups that have some clinical indications, about 20% has been positive, and it has been gone down a little bit now. I think because we're starting to test more freely after we got more of these sample sets.
Well, let's hope very much that the worst case scenarios don't become true, and that your island is safe from that. So all the best for coping with the stress there.
Yes.
And thank you very much for the interview.
Thank you very much, and take good care of you, and regards to all your audience.